My name is Suresh, director at Earthians, working for Marley Health for last 2 years. I've been with the team for last 2 years, and the journey was really exciting and eventful. Particularly from the last Frappeverse till now, we have developed a good amount of features into the product to make the product more robust and matured in the market. I would rather explain the journey in two parts. One is on the product side, other is on the community side. On the product side, in fact, everyone must be knowing that Marley Health has been evolving along with ERP Next. And in the last Frappeverse, we have discussed several goals that is going to be built in the product, particularly on the insurance and the patient portal, which is quite some time we are talking about that. I'm happy to announce that these two are brought into the core now. My colleague will show you the features in the system. Along with, we have also completed the RIS solution, Radiology Information System. This is also one of the key things, the most relevant in the today's market in the healthcare industry. We have brought that also into the system. After these two things, what we currently concentrating more on the region-specific statutory and compliance and standards for the product to make this Marley Health more commercially viable across different regions. This is one of very important things to make this product reliable and stable in the market. I'll give you a quick updates on these two things. When I say region specific, particularly for Indian region, ABDM is one of the key things which people are talking about. The government is trying to introduce, which is basically Ayushman Bharat Digital Mission. It's a digital ecosystem for the country. It intends to integrate various healthcare facilities like hospitals, clinic, labs, and pharmacy into one ecosystem. This is what the aim is all about. The implementation of this into, in fact, 3 stages, M1, M2, and M3. We have completed the M1 stage, and M2 and M3 is essentially for the testing with the NHA, a National Health Authority. The testing stage is being progressed now. We expect to complete this in 2 months' time. One of the other thing is, as part of the standard, is the fire compliance, FHIR, fast healthcare interoperability resources. This is again one of the standards related to ABDM. Basically, for the native internet standard developed by HL7, to ensure that the data exchange of information between the facilities to be fast and efficient. And this is also a critical thing as far as the product is concerned. Now, what we have done is, this is also we progressed extensively. And both these standards, we are trying to bring in a couple of months, maybe 3 months' time. We will bring all this thing. Now, by completing all this, we believe that Marley Health will become a robust product in the market, healthcare industry. And before I'm moving to the plan, what Marley Health is planning to go in future and the community prospect, let me invite Sajin to show you in the system what I mentioned now, and then I will take the rest of the part. Sajin, if you could.
Yeah. Thanks and hello everyone. I'm Sajin, a product engineer at Earthians. For the last few years, I've been actively working on enhancing Marley Healthcare. Today, I'm really excited to share with you the latest upcoming features that are planned for upcoming release. So, as you can see here, there were a few requests on the forum, GitHub, and Telegram group for the patient portal. We have already had the portal, but there were a few things missing. I took it up last month and soon realized the implementation wasn't quite extensible. So I ended up rewriting the whole thing from the scratch in the last few weeks. The patient portal is designed to give patient direct and easy access to their health data. They can also book appointments online without needing to call or visit the facility. And this portal also supports payments. As you can see here, we have integrated Razorpay. And with the printing from the portal, patient can print their diagnostic reports, prescriptions, or invoices. Next is radiology module. A few community members and prospects were inquiring about radiology. This was stopping us from approaching many facilities, especially diagnostic centers. This led us to create a radiology module. We had the RIS bridge for a few years now, but there were a few, it was not DICOM web friendly and had many glitches. Sorry. We have rewritten the RIS bridge recently. DICOM, if you are not familiar, is an acronym for the Digital Imaging and Communication in Medicine. And it's a standard which facilitates interoperability between radiology imaging systems. DICOM Web is for web-based medical imaging and defines a set of RESTful services. The RIS bridge is a CLI, which is essentially an adapter that transforms classic DICOM messages to DICOM Web API calls. It acts as a bridge for the radiology devices in a facility to connect with the cloud-hosted Marley instance. And Marley now supports worklist and DICOM Web APIs to update the status of the exam. Modality worklist or MWL allows devices like CT, MRI, X-rays, etc. to query RIS for the list of patients in queue for the examination. For this, we have introduced two new doc types, imaging appointment and imaging study. The imaging study even sports a JPEG preview of the DICOM assets stored in the packs. It is not yet production ready yet. We'll have to test it in real world and before merging. Next is Fire capability for Marley Healthcare. Very few Python-based fully open source Fire systems are available currently. As part of ABDM milestone 2 and 3, all health records should be exchanged in Fire format. We are now halfway building Fire capability within Marley. Fire or fast healthcare interoperability resources is a interoperability standard for exchanging healthcare data. In Marley Health, we have introduced a Fire resource map, which helps to map Frappe doc types to a related Fire resource. And this map will be used while generating the Fire resources. And we have this specifically for ABDM compliance, but we have plans to extend this as a feature. One of our clients needed a UI for the receptionist to easily book appointments and create patients and do billing from a single screen. They also wanted a patient self-service kiosk with a queue management system and check-in feature. The ask was for a Frappe UI app to enhance the user experience. The patient self-service kiosk allows patients to self-register, book an appointments, and do billing from without needing any staff assistance. As you can see in the screen, we can easily book an appointment. Also, there is a queue management system to manage the queue in different departments. A television size display to show the queue for the checked-in patients is also available. And there is a new appointment desk that can capture all the appointment details and patient status. It allows to register a patient, book an appointment, add vitals, and invoice services and prescriptions, view and contact details, etc., all without having to leave the page. We have plenty of options there. You can check it out. Apart from this, we have a few other features like patient referral. From the encounter itself, practitioner can now create a referral. This will create a service request with the selected appointment type. and a basic queue management is in place if you are using the front-end app. It also helps tracking the wait times and turnaround times extra. And practitioner can now set slots as unavailable so that the booking appointments are blocked. So in the last, in the patient appointment, get orders now fetches orders directly from the service request. In the last conference, we presented patient insurance module, which we added in this year. And some of you might know, we have already implemented ABDM milestone 1, but recent API changes are now handled. ABDM, if you are not familiar, Ayushman Bharat Digital Mission, is an initiative by the Government of India, having the entire population of India having their own unique health ID, and a way to track their health records in a secure way. And there is milestone 2 and 3 are under development. We will do the functional evaluation very soon. That's all from me. Thank you. So to Suresh.
Thank you, Sajin. With these features, what Sajin has shown now, we believe that it covers most of the requirements of HIS solution in the current hospital requirements. Now, what we are intending to do with the Marley Health is that we wanted to segmentize the product into four categories. One is that to facilitate for the super specialty hospitals with all the integration with HR, accounts, inventory, and some of the automation tools. Second is that mid-level hospital, which are focusing, maybe targeting for the tier 2 and 3 cities. Third is that the independent laboratories. There are a lot of laboratories are functioning in the country. Some are attached to the hospital, some are detached to the hospital. So to cover their hospitals facilities separately, we created third segment. Fourth is obviously for the clinics. Clinics are also a large number of clinics are there. But compared to Indian market, other markets are more, especially the Middle East market, clinics are plenty. So we thought we create a separate segment for catering their requirement also. This is what the product said all about. Second part of the journey, what I was mentioning about the community part. Basically, in the last year when we took over Frappe Health as our ownership and rebranded to Marley Health, our aim was to create a healthcare community, much like Frappeverse, Frappe for ERP Next. This is only possible with the partners' contribution and their effort to position the product in the market so that we can, the idea is that the product has to be implemented by the right people in the right way so that the end users gets the fullest benefit of it. You all know that healthcare industry is booming. There are a lot of opportunities in the market. If you see economically, the double digits growth always in the healthcare industry, in the segment. There is no healthcare industry is recession-free industry. Therefore, the opportunities are plenty. Now, what we have created to ensure that there is a group we created in TG. To connect all the partners, we invite all the partners to come in every week, not every week, on fortnight, on Thursday, 4 o'clock, we connect in the group to discuss the requirement, the ideas, challenges in the market, and how the product to be evolved in next requirement. So we are working on that. So I request all the partners to come and join and discuss so that we can make the product more friendly. My time is getting over. One more thing is that last Frappe, we also mentioned that we wanted to offer a warranty to the product. Basically, any product without warranty, confidence will not be there. On the reliability and stability will not be there. So we are taken that effort to assure you that the product is well secured and warranted. And we created a separate team for that so that partners or clients can directly contact us. All the kind of issues in core, any issues we wanted to build or any issues which are there in the already built one, we are there to support. This can also be used our community discussion. We can take it forward with that. So your contribution, your support is very, very important to make Marley Health very robust, innovative, and adaptable to the ever-evolving healthcare industry. With that note, thank you so much. I thank you so much for your contribution and support, and especially Frappeverse for giving our stage and unwavering support all the time. Thank you so much. You can contact us on this, and we are around here. Anybody wants to contact us or discuss anything, we are available here. Thank you so much.